Okay, hey guys, let's talk a little bit about the family chapter now. And I'll try and go quickly because I want to have one video. That is my goal. So quickly on the first slide, I talk about Rutter's kind of risk factors for the development of childhood psychopathology. And I was kind of thinking about this when I teach my PS 455, the child and adolescent psychopathology class. This is an important slide to think about. So why are more kids vulnerable, or why are certain kids more vulnerable? I feel like I'm too close here. Yeah. More vulnerable to having, the development of psychopathology, whether it's something like PTSD, whether it's ADHD, whatever. Depression, anxiety are probably the easiest to kind of think about when you apply this conceptualization. But why I think it's interesting to bring up in my PS 262 class is because so many of these risk factors for the development of psychopathology in children are linked to the family. So if you look at number 1, maternal psychopathology. So basically that means the presence of a psychological disorder within the mom. And so in general, anytime that a parent, I find as a clinical psychologist, when I work with kids, if a mom or dad is maybe having their own challenges that might interfere with parenting, it's a really stressful place to be for a kid. So kids don't like to feel like they're in charge of the family. So whether that be from parenting, whether that be because mom has a significant disorder, or whether because dad is in jail or mom's in jail. That's not a good feeling to have, that you don't have this great supportive net and that your parents are kind of at half-mast. That's not helpful. So I would flip-flop even 1 and 2. So maternal, I would say maternal and or paternal psychopathology, and certainly the second one, maternal and or paternal criminality, which just suggests that the parent has some significant legal troubles, so that could imply some genetic issues. That could imply obviously some poor role modeling going on. So if mom or dad are in jail, you don't usually go to jail for being an upstanding citizen all the time. So at least one thing had gone wrong in that individual. And that's also, take it from me, I've worked with a lot of kids, and I lived in my little suburban little bubble, and then I started doing work when I was a fellow at the clinic and beyond, and there's a lot more kids that I realized that had a lot of parents who were in jail and things like that, and that's really like embarrassing or a shameful issue for a kid. So you can see on a variety of levels the absence of a father or mother being there. If they're in jail, they're not physically present. Some of the maybe the shame, the concern, the worry, the economic crisis. You can name probably 10 more reasons why a kid might be stressed out if a parent were in jail. Again, mom having a disorder, that might be challenging. So other things here, so family conflict, divorce is a risk factor. Large size, again, just because you have a big family. If it's like a big, good, loving family, that's fine. But sometimes, even in a good family, there's a little bit less supervision, a little bit more likelihood that one person or another is going to have something going on, whether it be an environmental crisis or some kind of a disorder that might cause havoc. So just like the more people, the more likelihood of some chaos. Socioeconomic status, so that's certainly linked with the family too. And then finally, being placed outside of the home of biological origin, so something like adoptions, foster care. Again, typically there's a reason why kids are taken out of the home, and so that might render that child more vulnerable, from an attachment perspective, from lots of things. The take-home point too from this slide is just, it's not like one of these things in particular is the most oh my gosh, if you have a huge family, you're really in trouble, you're definitely going to have a disorder. It's actually just the more likelihood, the more of them that you have, and you can see how some of these things would certainly correlate. The more risk factors that you have, it's a much higher rate of having a disorder. So you can see some of these kids, like if you're working in the schools and the kid that you're working with and you're worried about has a lot of these risk factors, that should be a little bit of a red flag to you. So that's just my little 2 cents here. I'm not going to go into the changing functions of the family, but it really is important to kind of think about. Maybe this is something that you'll touch on when you do your interview assignments. Like, the family has changed. The family used to be the central unit of everything, and now again, because of just how our society is, we tend to, for lack of a better term, punt some of these responsibilities off. So I'm not homeschooling my kids because I want to maintain my sanity and not go into a mental institution. But it used to be that's what happened. And there's some pros and cons to that. I have much more control over what I teach my children in school. I have less interference with them. I can be more experiential with my children and take them and have more in vivo and hands-on learning. But I'm not doing that at this moment. But what it does say is like the primary function of the family is to kind of be there for you emotionally, effectively. Affect means emotion, supporting you. And it's not to say that the family doesn't serve some medical functions, right? But I'm not the one performing surgery or stitches on my kid. I'm certainly involved as a parent in those things with my children. But a lot of these things, again, are indirectly related to the families as opposed to directly. So even another example here is employer. Again, when you had a home or a family business or something like that, you're much more, the work interferes a little bit less with your job. So my husband, as an example, travels a lot. He works for Sherwin-Williams. He travels a lot. That affects our family. If he ran a business, I think he would try to travel a lot less. Or maybe he likes traveling and being away from our chaos. I'm not sure. Other things, a kind of a common thread throughout the course is that there's a lot of misconceptions about teenagers. And so one thing just to be aware of is that there's, again, like that whole idea of, oh man, just wait till your kids are teenagers, or why would you want to work with teenagers? People also assume this distance or this lack of getting along between parents and teenagers. And it's not as true as one thinks. There's not this huge emotional void or divide between them. There's some certain things that they are more likely to fight about, and I'll tell you, and certain people that they're more likely to fight with. But in general, they feel close to their parents overall, and they respect their judgment and so forth. It's just, sometimes it's like a safe person to argue with. So I know I was always kind of my best self, my most peppy little Tracy when I was at school, and sometimes I would come home and be such a grouch. And I think part of that, again, it's a reframe on the parents' part, but to say, clearly school is pretty exhausting. It takes a lot of effort, and the fact that she's able to completely be herself, even though that is sometimes the grouchier side of her, the more snippy side of her, she feels comfortable taking it out on me as her parent. That's, I think that's a better way to think about it, instead of assuming that it means that they don't like you and they're distant from you. So just, I think parents need to be educated that there's lots of kind of negative information out there. Conflict, it's always about the mothers. I hear screaming outside. I hope it's not my child. My husband's with them. Oh God, I hope not. Parenting never ends. So conflict is much more likely to be between mothers and daughters. And so that's, just something to be aware of, I guess. And you can kind of think and speculate a little bit about why. There's also, it kind of comes a little bit with tending to be a little closer to moms, both males and females. So that's a little bit of part of it. Another kind of essential thing that I want to talk about in this chapter, though, is parenting and divorce. So with parenting, keep in mind, there's not that everyone who, comes together is an opposite, but there is sometimes a saying that opposites attract. And so what that could possibly mean is that, I'm going to talk about some different parenting types in a minute. Your one parent could be, or one guardian could be one way, one guardian could be a completely different type of parent. Ideally, there's some common ground and a middle way of finding how to parent as a whole. There's also some general gold standards of parenting, but it's not always a one-size-fits-all model. One other thing I just wanted to say is like a little bit of a Dr. Masterson soapbox is, and I find myself sometimes doing it, but I really have tried hard in recent years to be more sensitive to this. I think the family is changing significantly, so it's not as commonly at all this kind of traditional nuclear family of a mom, a dad, and 2.1 kids or something. You want to make sure, a lot of kids that I've worked with are living with grandparents. A lot of kids I know are adopted. A lot of kids I know are in foster care that I've worked with. And so I think being really respectful of or have two moms or two dads or, whatever, step families. I think it's really important to kind of use different words, like, who is your guardian rather than who's your mom. Who's your this versus, you don't want to have any language that might make someone feel left out or a kid feel somewhat alienated or make his family feel any less than, because families are, they're very unique. Another thing, just as like something that always bothers me a little bit, all these kinds of father-daughter dance, father-son, blah, 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 all those kinds of things I think can be really hard for kids who don't have a traditional family structure. So, again, if you're in a place of making those kinds of decisions, I think maybe make it more all-encompassing rather than exclusive. Okay, so with parenting, you'll see Diana Baumrin talked about there's like 4 different types of parenting styles as a function of which dimension you're on of 2 dimensions or 2 constructs. So one is going to be warmth. So is a parent kind of high or low on warmth or responsiveness? So if a kid is upset, if a kid has something bothering them, are you going to be responsive? Are you going to warmly address that issue or not? And then also the idea of kind of control or demandingness is the same kind of synonym. So how much control do you have? So if maybe, like for instance, something that happened earlier, Lainey was talking back to me, I'm not tolerating that. She had to go inside, or she was being mean to Graham kind of, and I said, well, then you don't get the privilege of being with him. I have control over, I'm setting a limit for her. She can't just continue to act that way. So are they, am I high in control or low in control? Am I just like letting it go? So on and so forth. And so you can see there's 4 different parenting styles that are related to that, and I encourage you to read those and look at the outcomes that are linked with those types of parenting styles on the child and how they develop. So the gold standard is a combination of being high in warmth, responsiveness, and being high in control, in demandingness. So you're having high expectations and rules and limits, but like, with Lainey, when I just put her in her little, time away from Graham and had to go inside and she was away from some privileges, I talked about, it wasn't like, you're a terrible person, I hate you, you're such a bad kid. I said, listen, you're not being nice to Graham, and if you want to spend time with us as a family, you need to use a nice word. That's part of our family rule. So I'm also saying it in a way that's warm. I'm trying to teach her, to be part of our family, she needs to act this way. But I also have limits, and if she's going to cross that line, we're done. I'm so afraid I'm going to go into 2 videos, so sorry. Then, so kind of having a nice combination. I think all kids think they want that kind of parent that's super permissive, which is really high in warmth and really low on, control, but that feels pretty icky. Trust me, I've seen a lot of those kinds of families, and that can be really a little bit challenging for the kids. So in general, that's the gold standard. So the other one to think about is authoritarian. And I think one way to remember authoritative versus authoritarian is authoritarian sounds a lot like a disciplinarian, and that's their primary goal. Or that's their primary focus. So they're very stringent. So you think about like that traditional like military kind of parenting or something, very this is my way or the highway type of mentality, having a very strong control in the absence of warmth, right? I will say, though, as much as we can probably think, oh, that's not super ideal, what I will say is that sometimes it depends on the situation. And I'm not at all, and in fact, we can have a whole other conversation about why why corporal punishment is not a good answer and outcome, and there's, again, plenty of reasons why. It's not teaching the kid anything, it's modeling bad behavior. I couldn't help myself to tell you guys. And it's also, if you're engaging in like hitting your child when they're bad or misbehaving, you're in a elevated state of anger and aggression, and that's not a good combination. Being angry and aggressive and then using physical violence does not lend itself to good outcomes. And then also, that's that can only last so long. Like, I'm not a huge person, and so the only way I learn how to punish my kids is by hitting them physically. When my kid is 16 years old and is a head taller than I am, that's not going to be super effective either. So, but anyway, my point is with authoritarian parents, sometimes in certain settings, like perhaps a dangerous area or a gang, an area of like high gang activity or something like that, it is better in some ways to err on the side of control, not harming the kid, not physically, but being very tight in your control sometimes, as opposed to warmth, because the stakes are kind of high. And so just what I'm saying is the research shows that it's not, again, there's certain populations and certain rationales for why sometimes a more authoritarian parenting style can be good, but typically only in those settings. So back to video 2. Sorry, I talked too much.